Namaste, I am Dr. Shobha Venkat, Senior Consultant Obstetrician and Gynecologist at Cloudnine, Old Airport Road, Bangalore. It is very important to understand the term called the chorionicity in twin pregnancy, because the outcome depends on the chorionicity. Chorion is a membrane which covers or surrounds the baby, and depending on the number of the chorion membranes, we call it as dichorionic or monochorionic pregnancy. So, in dizygotic twins, invariably it will be dizygotic and dichorionic pregnancies, whereas in case of monozygotic, it could be the monochorionic or it may be dichorionic depending on the stage of division. So, if it is a monochorionic twin pregnancy, the risks are more associated with the monochorionic pregnancies compared to the dichorionic pregnancy. That is where lies, it is very important that we identify the chorionicity of the pregnancy, which can be done as early as 11 to 13 weeks scan, so that we can lay down the prognosis associated with that type of twin pregnancy. Gold standard for the diagnosis of multiple pregnancy would be our ultrasound scan. However, some of the symptoms are a little bit exaggerated in multiple pregnancies because of the two babies and the excess level of the hormones in the body. In the first trimester, it could be the excess vomiting, which we call it as the hyperemesis gravidarum, and probably in the second trimester the patient may complain of excess baby movements, and towards the end they may have many symptoms because of the overdistension of the uterus, like the breathing difficulty, sleeping difficulty, eating difficulties. These are some of the symptoms which is extraordinary for the multiple pregnancy. Up to 20 weeks of pregnancy, more or less a singleton and a multiple pregnancy remains the same. But after 20 weeks of pregnancy, because of the rapid growth of the baby, there is an overdistension of the uterus and there could be the shortening of the cervix. So, the multiple pregnancy patients are at risk for the early delivery, what we call it as the preterm delivery. Because of this risk, somehow we recommend not to avoid the strenuous exercises and activity in multiple pregnancy. However, there is no need for the complete bed rest. They can carry on with a normal activity, but just to avoid the strenuous activities so that they don't risk themselves for the preterm delivery.